Here are the latest stats for you. 505 inmates and 50 staffers have been infected. 19 of the inmates are still hospitalized. 6 have been released now. And we're just getting word that 1 inmate has died, although the cause of death is under investigation. KPIX5's Wilson Walker on the outbreak's potential impacts beyond the prison walls. Wilson?
Yeah, Ken, as you mentioned, 19 inmates now hospitalized. And the big question is, if that number were to grow significantly, where would you put more patients? Where would you find more hospital space? Marin simply can't do it on its own.
If we continue to see increased infections at San Quentin, area hospitals across the whole Bay Area will be impacted. And that's what CDCR is doing right now, finding out where hospitals have capacity.
Calling the situation in the prison a crisis, Marin County is now asking Governor Newsom to put an incident commander in charge.
We need to have someone that's able to make good decisions to protect the health and safety of the prison population and make sure that there isn't a capacity issue in our local hospitals.
Well, we're working, actively to take a regional approach to this. This is a state facility that happens to be in one county.
County Health Officer Dr. Matt Willis says everyone understands that Marin needs help, so the state is drawing up a plan for how to spread the very sick to hospitals around the Bay Area.
And so there's an allocation regionally that ensures that people are getting timely care and that it's equitably distributed into places where they can manage the cases.
But there is frustration that the situation happened at all. Assemblymember Mark Levine was asking about outbreak plans here at San Quentin 2 months ago.
I asked CDCR in San Quentin to create a site-specific plan to deal with the outbreak of COVID back in April. And in May, they declined to do so. But what we've seen now with the transfer of inmates from Chino to San Quentin is that they had no plan at all, whether it was written or unwritten. We need to have someone in charge that can make good decisions. I think that we need someone with a background in public health that has decision-making authority.
Okay, the 500 plus cases here at the prison, by the way, are not counted toward Marin County's case total as a whole. I asked the doctor if he is concerned about the virus sort of spreading beyond the prison, just the virus itself. He says no. He says San Quentin is isolated enough from the rest of the county as a whole that he doesn't see the virus spreading beyond the walls. And as far as an infection vector, he says the case numbers that are rising in Marin are coming just from regular citizens, people that are out working at construction sites, going to restaurants, and gathering with their friends. We are live here at San Quentin. Wilson Walker, KPIX5.